This is the 1597th day of continuous webinar. And today our guest is Dr. ROHIT Sharma from Canada. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi, and from 7:30 to 8:30, and we have an international session from 8:30 to 9:30, and a local language session in Malayalam from 9:30 to 10:30. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again, and you can subscribe the same without paying any money, as well as you can share it with your friends, as well as homeopathy lovers, so that the purpose of the International Forum for Promoting Homeopathy is to take homeopathy to every household around the world. And we are able to reach some such things in the past also. Anyway, let me come to today's guest. Dr. ROHIT Sharma is a registered homeopath in Canada, and he's done his registration at College of Homeopaths, Ontario, and his clinic is known as Clinic Homeopathy and Health Inc., and it is at the Brampton, in Canada. He has more than 19 years of clinical experience, and he has presented some sessions before in our forum when he was in India, and now he is settled there in UK, in Canada. And today he will be talking about utility of homeopathic repertory in fetal well-being. As you all know, this is a very important subject. Use of repertory, where that is to be studied by each and every homeopath, but we have a different type of repertory, and all these repertories have some speciality in it. Some people follow Ken repertory, some follow snare repertory, some follow product repertory, but maybe the purpose of using repertory is to find the right remedy in the shortest possible time and the perfect remedy as far as possible. So let us proudly welcome the guest of the day, Dr. ROHIT Sharma. Welcome, Doctor. Yes, Dr. ROHIT, please open your video. Yes. Yes, please unmute yourself. You are a please unmute. You are a co-host. Yes.
Okay. Am I audible now, sir?
Yes, you are audible.
Hello, everyone. Myself, Rohit Sharma, registered homeopath with College of Homeopaths, Ontario, Canada. It's my pleasure to welcome you all on this webinar, that is Utility of Homeopathic Repertory in Fetal Wellbeing. Thank you, IFPH and Dhanesh sir, for giving me the opportunity to share my views and knowledge with all of you. Thank you so much to all of the participants who are present here today. Before going to Canada, I had privilege to practice homeopathy in India for a very long time. And in that time, I have used the repertory in each and every case. As my mentor had told me that you have to repertorize each and every case, because after repertorization, always you have a chance to have new remedies, perfect remedies. Through these experiences, I have developed a deep understanding of how the repertory can be the powerful tool in selecting the homeopathic remedy. Now, This
Yes, yes, we can see the screen.
yes, sir. So this session will explore the overview of fetal developmental stages, importance of homeopathy in pregnancy, role of homeopathy in fetal health, targeted homeopathic care for every trimester, including a short case study. In general, we have to teach the masses that why homeopathy is essential during pregnancy and busting myths, misconceptions about homeopathy in pregnancy, that it is slow and unsafe. Safety of homeopathic treatment for both mother and the baby. How homeopathy supports healthy pregnancies, and benefit of combining the homeopathy with conventional approaches. Being homeopath, we should highlight improvements in maternal health and positive outcome for the baby. The repertory, first developed in 19th century, has evolved significantly with modern software, making it more accessible and practical than before. There is overview of fetal development under stage, the first trimester, which is of week 1 to 12. There is formation of major organs like heart, brain, and lung, and structures like limb and spinal cord. In the second trimester, that is week 13 to 26, there is rapid growth of and maturation of organs, development of sensory functions like hearing and movement. During third trimester, which is from 27th week to 40th week, significant weight gain and brain development, lungs maturation for breathing, and immune system strengthening, preparing for birth. Then comes the factor influencing the fetal development. There is multiple factors, and one of them is the maternal nutrition. An adequate intake of nutrition like folic acid and iron and calcium are very supportive for growth of fetus. Second is the lifestyle habits which we have to follow. Then you have to avoid the smoking, alcohol, and the use of drugs which can harm the fetal growth. And third is the stress level. Chronic maternal stress increases the risk of preterm labor or low birth weight. Then there is critical role of maternal health. Critical role of maternal health in fetal well-being. It's her physical health. Physical health. Mother has to avoid infections. She has to be fine. There should be no anemia and the poor metabolic rate. Even this can alter the effect of fetal well-being. Mental health, anxiety and depression can alter the hormone level, impacting fetal growth and temperament. Then there is immune system. A highly immune system prevent infections that might harm the uh, fetus. There is uh, emotional well-being directly impacts the fetal brain and emotional development. There are some environmental factors too. Exposure to toxins can lead to congenital disabilities. if there are pre-existing health conditions, we have to look over them. For example, diabetes is there, hyper or hypothyroidism is there. If these problems are there, we have to control them, otherwise they can affect the fetal well-being. Now this is the overall things in short. Now I will proceed with the repertory, because it was the my main topic. So briefly, first of all, I would like to go with the rubrics which are related to fetus, and there most of the time we don't utilize them, and we have prefixed medicines in our mind to use, like pulsatilla, sepia, colophyllum. But today's session will reveal that there are so many other medicines. If we think them correctly, or if we pursue them to the repertory, we can reach the right simillimum. In short, now I will start with the rubric which is from the stomach. There is a rubric: stomach pain, motion of fetus aggravation, and there is sub rubric behind that rubric is burning. Means that there is a pain in stomach which is carrying the burning character, or either burning present or burning not present. But in both medicine, in both rubrics, arsenic is common. Now arsenic is common might be the reason that the fetus might be feeling the restlessness, as the arsenic is the keynote uh, keynote symptom. Arsenic restlessness is the keynote symptom of the arsenic. It means that either the mother is restless or the fetus is restless, but the indication of arsenic is showing that this might be the reason. So this rubric is there in the stomach. Again, in the stomach, there is another rubric, vomiting, which is very common in pregnancy, throughout the pregnancy. But if the pregnancy, if the vomiting is related to the movement of fetus, whenever the fetus move inside and there is vomiting, then there are two options. These are arnica and psorinum. Similarly, the same rubric and a cross reference is given in female genitalia, fetal motion. There are one medicine, arnica. So we never consider the arnica to be given vomiting in during pregnancy, but arnica is common in both the rubrics. So this is a close medicine. We never think about the arnica, but repertory revealed it, that it should be in our mind. That similarly, if we open the section abdomen and moving forward in the abdomen, movements in fetus, fist of fetus, like the fist of the fetus, like. So there are cornivalia, natrum car, petroleum, salicia, sulfur, tarantula, and thuja. These are the medicines. So moving forward, there is a rubric, female genitalia, abortion, seventh month, and the fetus comes out the dead, and the single medicine is there, ruta. Similarly, another rubric is there, female genitalia, fetus dead, expelled. So there are three medicines in this rubric, that is cantharis, pulsatilla, and ruta. So ruta is common, that fetus used to abort at the age of at the month of seventh month and expelled. And there is one more rubric under female genitalia, fetus stillbirths. There is single medicine, colophyllum, which is registered in synthesis by Day Christograph, who is a veterinary physician. Uh, there is one more rubric under female genitalia, motions. When the fetal movement ceases suddenly or decreasing or ceased completely. Either the movement is decreased or ceased suddenly. So there is a common medicine, colophylum. So colophylum, if we can see in recent 3 rubrics, it is coming. Stillbirth, then the movement ceases suddenly or movement goes down, movement decreases. So colophylum is common in these 3 rubrics. We will study further another rubrics and group of rubrics where colophylum will fall in another rubrics too. Now there is an interesting rubric when moving forward, that under female genitalia, fetus, motion with music. Otherwise there is no motion, but whenever a music is going on, music is playing somewhere, the fetal movement started, female movement uh, starts down. So there is a one medicine in this, that is carcinosin. So this could be, we can kept in our mind that we don't met this rubric in routine, but through this session we can, it will be in our mind that somewhere we have listened that such things can be there. Now fetal under same the female genitalia, fetus movements which are painful. Sometimes these are not painful, and sometimes it is painful. So under pain, there are few medicines like arnica, conium, crocus, opium, pulsatilla, CP, and cilicia. Now, if you recall back, I have told you that this under the stomach there is a vomiting from fetal movement. Similarly, in the genitalia, vomiting from fetal movement. And if we club this rubric, which is painful, then the only one medicine is the arnica. So arnica is carrying the painful movement, and the from movement he has nausea and vomiting. So how arnica is, we never think that we arnica will be prescribed in the pregnancy or in such situation, but arnica is coming out. When we will move further, we will see that how these remedies on in group of rubrics will show their shades. Now the movements are, when the fetal movements produces rawness, then we have 2 medicines, that is sepia and trictic. And sometimes the mother feel the sensation of the movement of fetus. We have 2 medicines, natrum carbon, tarantula. And one rubric is very important, which is now I will discuss with you. That is, due to fetal movement, the sleep is disturbed. Due to fetal movement, the sleep is disturbed. We have arnica, conium, opium, sepia, and thuja. Now, when you will club the one rubric that there is a fetal movement which is painful and it is disturbing your sleep, you will be surprised that arnica, opium, sepia, these all medicines are common. So being a routinistic prescription, or when we prescribe medicine exclusively on our prior therapeutic knowledge, we will miss these informations. These informations have already written in the repertory. Just there is need to explore, need to share, and IFPH is providing this platform to all the homeopaths to share their views, and this will help a lot to all of us in future. There is one more rubric which is coming now. Next is somersaults. Somersaults in Hindi we call it kalabaji. Somersaults. So there is a single medicine the lycopodium inside that. Now, what is the difference between somersault and normal movement? Although somersaults are also the fetal movement, but they are very complex. Intensity is more forceful than normal fetal movement. Pattern involved is a complex pattern. There is complex pattern. Frequency is little bit less and duration are brief. So lycopodium is the only medicine in this rubric. Kalabaji, what we call in Hindi, and the somersault is a rubric given. Fetal somersault is also known as the fetal gymnastics. So it's a kind of rubric. Again, moving forward, under the same female genitalia motion, cutting pain in the bladder with desire to urinate and thuja is common. If there is desire to urinate or urine comes out, the thuja is there. However, thuja is also in the painful movement too. And now there comes the violent movement. The same under the female genitalia fetus movement, violent. We have arsenic, crocus, lyco, medroinum, opium, sorinum, silicea, thuja, and triticum. If you see that in these prior, in what I have discussed previously, almost the medicines are same. They are coming close to each other. The violent movement and the somersault, the lyco is common, and in the other cases, if the if the fetal movements are violent and there is the vomiting, which is from there is the pain associated with burning, then arsenic could be the choice. So we will club those rubrics later on to find the different medicines. Now move to the next rubric, which is related to the position. Although there are many fetal positions and they change with the time and duration, but under abnormal positions we have aconite, arnica, simsifuga, medorinum, pulsatilla, and sepia. Again, the arnica, if you will see, the arnica is coming out here too. If we will talk about the breech presentation, there is single medicine pulsatilla, and in routine we used to prescribe pulsatilla in many such conditions, or many throughout pregnancy. Pulsatilla, sepia, these are the routinistic medicines which we used to give. But if the position is crosswise, which is a different position, then arnica will be the choice. So while I was preparing this lecture, I have seen that arnica comes under so many rubrics, and it is never considered, never given any weightage that arnica can be so useful in the fetal well-being, and throughout the session of pregnancy, it would be the beneficial remedy. Now there is one more rubric which is carrying only one medicine, but it is room, as if had lack of. If I have never utilized this rubric and never studied, but there is a rubric. It carries the one medicine, that is plumbum met. Now I will share one more medicine, which is very different medicine, that is female genitalia pain, labor pains, sense with every pain fetus seems to. This is a rubric. In Hindi we call that जब भी पेन होती है तो उसको लगता है कि वो जो बच्चा है ऊपर की तरफ आ रहा है. Then there is a single medicine, gelsemium, and such type of symptoms are often most of the time we have seen and we have, but either we have not given the Gelsemium, or we have not prior information of this medicine. Now there is one more medicine, one more rubric, which I will share, which is found in the this is a rubric that is female genitalia, pregnancy during complaint, fetus, many fetuses because of two. It is in front of you, but this was recorded by a veterinary physician, and most of the time this type of condition is found in the animals, in cats, female dog. Most of the time this is seen in the veterinary cases, but sometimes we have twins or more than twins, so never use this rubric. This is just for the reference, and if the reference is there, someone will definitely use it, and to this platform he or she will later on share its utility. Now I will go with the another rubric which is found in under the chest. There is a rubric under the chest which is motion of fetus aggravate. The chest symptoms got aggravated from the motion of fetus. There is single medicine, sulfur, and there is another considered rubric under the chest, that palpitation of heart from motion of fetus. Again the medicine is sulfur. So under the chest we have only two rubrics which are related to fetus, and there is single medicine, sulfur. So anything if you found in the chest is involved, and there is palpitation, then sulfur should be in your mind, that it is the appropriate synonymum to that acute or the same condition. Remember, there are only two rubrics in chest related to the fetus. Again, if we will move forward under the section sleep, there is the rubric sleeplessness, and also sleeplessness fetus from painful movement of. Due to pain, patient is not able to sleep, arnica. If you recall the past, I have told earlier that if there is disturbance of sleep, due to fetal movement, we have 5 medicines: arnica, conium, opium, sepia, thuja. But if there is complete sleeplessness, there is only one medicine, that is arnica. Now you can see that how arnica is found in so many rubrics throughout. I have discussed all the rubrics with you. Then there is a rubric which is most of the time we don't met such situation. It's the emergency situation, but there is a rubric in general: faintness, pregnancy, aggravation during motion of fetus, slightest. When patient gets faint due to slightest motion of the fetus, there is one medicine only, and there is one rubric which is in general too, and the medicine is laxative. However, this condition we never used to met, but it should be in our mind that yes, uh, there is a medicine, laxative. So this is the whole brief outlet. However, this topic is very broad, which is related to pregnancy, to parturition, postpartum conditions after pregnancy, and also associated with the gynecological parts. But I am touching today only the small part that is related to fetal well-being. So now I will share one. Now we'll move forward with now this I'm sharing now this the next slide. Now you can see that what I have found, that if we will club these rubrics, these are in front of you, that is related to fetal well-being, that the female genitalia, abortion in early months, first month, second or third month, fourth month, and if there is the tendency to abortion and there is repeated abortions. These are 8 rubrics. Along, if you find what could be the remedy in these rubrics, it is a story of every person who used to suffer from repeated abortions, or that there is no fetal well-being, or there is a miscarriage in first, second, third, fourth, up to fourth month, or there is tendency to abort. You will be surprisingly to know that the common medicine in this 8 rubric, and which carries the maximum weightage, is apis. And apis is also considered not to be given during pregnancy, that it is not good for the it can abort. So how therapeutically this medicine can save the mother and the little one, if we have a history, we have this knowledge, we can treat a patient and make it ready that she should not abort during his pregnancy. Now I will share its the repertorial chart of this. Now this is the when I club all these rubrics together, surprisingly I have seen that Apis is carrying all the rubrics with 16 as the weightage, and it has covered all the rubrics. Very surprisingly, when I moved down, I saw that Thuja is carrying 5 rubrics. I have mentioned the rubrics, the number, that is 4, 5, 6, 7, 8. The number rubric are covered by Thuja. Similarly, Toxoglandi is the medicine, Viburnum is there, Kalicarb is there, Sabina is there, Cecal Cor, Simsifuga, Plumbum, Colophyllum, Sepia. There is a list of medicine, but we used to give Colophyllum, Sabina, Sepia. There are Cecal Cor. There are so many medicines, but never we will consider the Apis. Apart from this, all these symptoms of Apis, there is a rubric in the under the bladder, that is retention of urine delivery immediately after delivery. If there is retention of urine, Apis is the medicine. And even in the mind, if the ailments are during pregnancy, the Apis is also there. However, I am not considering the mind part, and I am not considering the physical ones. But what I have seen, the fetal, where the fetal well-being is disturbed, or fetal well-being can be disturbed for his well-being, if such type of pathology we met, repeated abortions in first, second, third, fourth, and their tendency, so Apis could be the option if given early. And if the mother will conceive, there are less chances that uh, there will be miscarriage. But remember one thing, what I have studied, that Apis should not be given during the pregnancy, or if we want to give, it should be given very carefully in low potency. However, I have never given it. I have prepared this lectures. So, and by understanding, for understanding it, I have come to know that yes, if such type of case will be there, we have to keep such things in mind. If apis is coming in front of you, it doesn't mean that we will give it the apis to the first month or second month during the pregnancy. We have to be very careful. But if there is a history of repeated miscarriages and repeated abortions, we can give it. It can help the mother to conceive, and there will be no abortion further. Now, I will consider the next medicine, which is even not in this um repertorization chart, and surprisingly, which is not in this given chart, because this chart is covering the fetal well-being from mother point of view, that if the mother will not abort, her health will be good, the fetal well-being will be there. Now I am again coming to the same platform where the fetal well-being is more related. Now surprisingly, now the second medicine will come, which is rubric is fetal movement violent, as we have um, discussed previously. Another rubric is female genitalia and the fetal motion is painful. Third, it is disturbing the sleep, and the fetal movements are violent. Now, when we will club these four rubrics, if I will say in the fastly, then it will be that the fetal movement is violent, it's painful, it's disturbing sleep, and is very violent. There is a single medicine, opium. Now, we never consider opium to be given during the pregnancy or the things, but what repertory has revealed me, what I have learned from the repertory, that never, don't underestimate the utility of uh, the opium. After the apis, the opium is the next one. However, it is not in this chart. It is not in the, if we will see the abortive history about the rubrics concerned with the abortion, but if the movements are wrong and painful, disturbing sleep, then opium could be the choice. Even in the mind section, I have studied that there is rubric mind, anxiety, pregnancy in, there is a fear that there will be abortion in later part. There is a fear, there is no abortion, but there is a fear that the baby will, the fetus will abort. This is anxiety. It carries opium. Again, under female genitalia, there is the same kind of rubric, abortion fear from, even it if it happens, then there is an option opium. So it is these two rubrics are to be kept in mind when we met such condition, that there is a history of abortion. The lady may say, the mother may say that I was very, I have very anxiety during the last month of my pregnancy or throughout my pregnancy, that my, my there will be abortion. And uh, the other rubric which revealed that abortion fear from, it's kind, the anxiety and fear are very much correlated. If you will see from rubric point of view, that anxiety and fear, first anxiety was there and then she got aborted due to that anxiety or fear, then this group is also carrying the opium. So if you will club all seven things, or you will keep all these things in the mind, then you will feel that opium is also a very, very, very important remedy, and we must consider it uh, in our practice. Now, I'm moving with the third one. Now, I'm moving with the next option, which the option is arnica. Now I will, yes. So apis I have discussed with you. Opium I have discussed with you. Now the arnica. Now surprisingly, I myself revealed that how arnica is the most important remedy, and I never considered myself it as important as it is in the repertory. So, though the first rubric again, the stomach vomiting, fetal movement. Second, female genitalia motion, nausea and vomiting. And if the motion, fetal motion is painful and it is disturbing sleep, and there is complete sleeplessness, then all will point out to arnica. And there is one more rubric, that is position, that is abnormal position of uh, fetus. Abnormal, under the abnormal position we have 6-7 medicines, but under the breech position we have only one medicine, that is pulsatilla, which many homeopaths have used in their practice. But there is a rubric that position abnormal crosswise as a line. So there is one medicine which is arnica. So before we prescribe medicine pulsatilla, now there is one more medicine arnica in your arnica will be there in your mind, because pulsatilla has its own symptoms. We will discuss it later. But if there is pain from movement, nausea and vomiting, very painful, and sleep is disturbed, and the position is cross. So, arnica could be the right option, or arnica could be the appropriate minimum in such condition. Now, I will move to the another option, which is sulfur. However, I have discussed this earlier that there is there are two rubrics in the chest, that is motion of the fetus aggravate and palpitation of heart, motion of fetus aggravate, which I have earlier discussed with you. But I would like to enter one more rubric, that is from abdomen section, that movement fetus fist like. However, these three rubrics are there, then there is feeling of fist, there is the motion of fetus in the chest, and palpitation of heart. So in such situation, sulfur is the right minimum. Sulfur could be the right option. However, we have to consider the case as a whole. But what I have seen that these options are also there. We should not miss any option. Now, the another one is pulsatilla. Now, pulsatilla is very common medicine used in females in all type of problems. And there is, I think, there is no need to explain the about the pulsatilla, because mind part is very prominent and journals are very prominent, and this remedy is very well proved and well known to all of us. But there are three rubrics again which I will like to share in short. That is female genitalia, fetus dead expelled. We don't know that when it is already dead. We have ruta in this medicine, pulsatilla is there. Then motion painful, then position abnormal. Under the abnormal position, you have one is the arnica and other one is pulsatilla. So again, I will go with the another option. I will share the if we will go with the option of colophyllum. Now colophyllum is a wonderful medicine which covers the rubrics 1378 in this repertory chart, 1378. And again with that, it covers the very beautiful 3 rubrics, which is of which are not included in this chart. However, colophyllum is at bottom when we will consider the abortive history, but colophyllum has tendency to abort, and colophyllum has the tendency in the abortion in early months. But what I have selected or find out that apart from this repertorial chart, if you will go with another 3 rubrics which are very important, when there is stillbirth under female genitalia, female fetus rubric is stillbirth, there is medicine colophyllum. Then again, if the motion, there are normal fetal movements, but when these motions ceased suddenly, when the normal motion is there, when it ceased suddenly or ceased completely, there is only one single medicine in these 3 rubrics, along with these 1, 3, 7, 8. If we will go to the repertorial chart rubrics, there is one medicine common, that is colophyllum, and colophyllum is also used frequently throughout the pregnancy in various conditions. But when there is a history that there is still history of stillbirths, or the motion has ceased or suddenly decreased, then we have to be very careful. We have to go to the higher centers to know the status of baby's health, that why the motion, why the fetal movement ceased or ceased suddenly. And surprisingly, these all rubrics and the colophyllum is listed again by the day crystographer, a veterinary physician. He has listed and listed in these rubrics on synthesis repertory. So we should be one thing I want to say, that we should be very thankful to those persons who are by profession, they are veterinary physicians, they opt homeopathy, and they successfully used these medicines in veterinary cases. Although the principle is same for the female animal and the female human being, and they have listed these rubrics in this synthesis so that we can use and we can study them well, and it can help humans too. Now I will move with the another medicine, which is sepia, which is at the uh, lowest part, at the lowest part, but it is used frequently. It is the most important medicine which we used in females. It is a routinized medicine, but in case of, but how you can see that no one can before doing this, we never consider that apis could be at the top and sepia and pulsatilla could be at the lower side in case of repeated abortions or such histories. When you consider the sepia, it also carries a rubric 1, 3, 6, 8. First month, third month, and there is a tendency to abort, and there is uh, another rubric which is there as fetal genitalia motion, and due to this motion, the mother got disturbed sleep. We have discussed it earlier, but if there is if associated with motion, if there is disturbed sleep, sepia could be the option. However, sepia could be sepia we can select on as a pulsatilla is a very common medicine, so sepia could be the selected on the other symptoms too. However, I have selected only the rubrics which are related to fetal well-being or fetus or this particular condition. For sepia and pulsatilla, we have enough constitutional grounds to consider that whether we will give or not. Now we will move to one another remedy which is less frequently used, but I have this is a common medicine. This is common medicine coming in this chart, which is at second number, Thuja, Thuja occidentalis, which is broadly covering the 5 rubrics almost. And there is again, like sepia, also due to fetal movement, there is disturbance in sleep, which we have discussed earlier, and there is motion. There is no pain, but there is a fetus like fist. There is a feeling of like fist. So thuja is there in this condition. We have we can consider it if we want to. Thuja could be the option. Now I have discussed almost uh, the all the now from here we can see that how the if we arrange the rubrics, if we arrange the uh, rubrics in a parameter, then we can get the right simillimum. There is a option of more simillimum. So it's all about the rubrics. It's all about the studies we combinedly study. And I will now move further. There is the broad rubric under female genitalia, abortion, and there are so many rubrics which we can study if the time permits. There is a beautiful rubric that there is female genitalia, abortion. We have earlier discussed cecal cord abortion accompanied by the swelling of uterus, weakness of uterus. So this could be a different session that when we can discuss about the utility of homeopathic repertory in abortion or pregnancy or these things. When abortion in
Yes,
early months.
yes, Dr. Rohit. Only 4 minutes remaining, so we can have another session if you want on
Okay,
the same subject. It's a very good
so
subject.
sir, I would in the end I would like to submit a very short observation in India. I will not claim that I have cured this case or I have done something, but I would like to share that once a lady came to my clinic in the evening during the session during winter, and she has the chilblains over chilblains. She came to me for the chilblains, and she told me that she is pregnant. Then I hesitated and I told her that you must go to the gynecologist and you must ask her that I don't want to give the medicine in such condition. But already I have cured her so many times, so she insists that you should give me the medicine. Sir, his constitutional medicine was phosphorus at that time, and I prescribed phosphorus 30 to her. 3 or 4 doses I have given, and she recovered. She recovered from that. But one thing was common. They came back to me after a month, and they have told me that, sir, there is a good news. Although the pregnancy was of 7th month, they have told me that the PGI, yeah, the consultant, their physician has told that uh, the fetal health was disturbed and the kidneys were not developing. There is arrest of development in kidneys of that uh, baby inside the mother. And surprisingly, their consultant physician has told that you have this this baby has to take treatment, long treatment for his kidney. But surprisingly, on ultrasonography, suddenly this kidneys growth
Oh,
started again. So
okay, doctor. That's fine. And anyway, we can you can present the case in details in the coming edition of our session. Since only we have to conclude the session, another session is coming in our local language session. So I
okay.
invite Dr. Manoj to say the vote of thanks to the session.
Yes.
Thank you, sir. Thank you very much, sir.
Thank you, Dr. Danesh. Dr. Rohit Sharma's wonderful presentation. We all know that the fetal medicine is just developing, but homeopathy is already developed. What is needed is combined effort, and we need institutions and more publications. So on behalf of IFPH, I am expressing sincere thanks to Dr. Rohit Sharma and all those participants in this English session. Thank you.
Thank you very much, sir. Thank you.
Thank you, Dr. Manoj, Dr. Rohit Sharma, and those who attend the session. We are very happy to say that your presentation was so brilliant, and we can have the second part of the same in the coming month itself, so that everybody can follow the same, and we can have a discussion later in the second part of the session. And tomorrow we will have a session from Dr. Yamini Ramesh, and Doctor will be talking about overview of general kingdom, overview of mineral kingdom tomorrow. With that, we come to the end of the day 1597. Thank you all. Good night.
Thank you, sir.
It's over.